Well, a few important points related about the burn injury. My topic is burn injury, so definition is about the burn injury is that it is just an exogenous agent leading to the coagulative necrosis in the tissue, and it divides into the first degree, second degree, and third degree burn. So another classification according to the structure is the superficial, partial thickness, deep partial thickness, and third one is the full thickness. First is the superficial partial thickness is also known as the first degree burn, and it is painful and is much more painful. It goes no deeper than the papillary dermis, and clinical feature dermis is pink and moist. Capillary turns clear when blanched. It is known as the capillary blanch test, and next test we perform for the investigation like that pinprick sensation, and it will be the normal in the superficial thickness, and it heals without the residual scar within the 2 weeks, and you don't need any surgery for the superficial scar or superficial partial thickness. Next is the deep partial thickness. Deep partial thickness is damage to the uh, deeper parts of the reticular dermis, and epidermis is usually lost. Damage to the part of the reticular dermis only. As you know, it's a superficial damage to the papillary dermis, and in the deep partial thickness, it damage to the reticular dermis. Means it goes deep into the dermis, so the epidermis is usually lost. Exposed dermis is not moist, it is not moist like superficial partial thickness, and capillary does not blanch with the pressure easily with the capillary blanch test. And another skin prick test, which is used sharp when patient unable to distinguish the sharp from the blunt pressure when needle is inserted or like on the skin. It is difficult for the patient to distinguish between the sharp and blunt. Next is the deep dermal burn. Takes the time for more than the 2 weeks without surgery, and it leads to the hypertrophic scar. And last one, and it is also known as the second dermis. And second dermis means involve the blisters, and in the first degree burn only the skin are involved, and it is much more painful. And in the full thickness, it means the whole dermis is destroyed, and it is too hard and leathery feel. Charred black sometimes are formed in this patient, and thrombosed vessels are seen as the skin got stuck into the deep dermis. It is got stuck into the deep dermis, so it's very painful and it is uncurable. You are going to give the iron intravenous fluid resuscitation. Tell me the next.